Imagine this. You're 68, sitting in your living room, and the doctor has just added your 7th pill for your own good. Your head feels heavy, your legs are weak, and deep down you wonder, is this really health? Or am I slowly losing myself to medication? Before we start, make sure you subscribe to Simple Elderly Wisdom, like this video, and share it with someone who is quietly worried about getting older, but too afraid to ask the hard questions. Welcome to Simple Elderly Wisdom. Today's story is about 7 diseases that may not be diseases at all, but natural signs that your body has walked a long, faithful journey. Yet because of fear and rushed visits, many elders are treated as broken machines instead of wise, adapting bodies. This is not medical advice, but a gentle invitation to think, to ask, and to remember, your age is not a diagnosis, and your value is not a number on a chart. Meet Samuel, 72, a retired teacher who used to walk every morning, correcting his grandchildren's grammar just for fun. One day at a routine check, his blood pressure shows 145/88. The nurse frowns, the doctor sighs, and suddenly he walks out with a new prescription and a warning about strokes. Within weeks, Samuel feels dizzy when he stands, his vision blurs, and he stops walking, afraid he'll fall. The pill meant to save him quietly steals the mornings he loved most. What nobody explained to Samuel is that blood vessels at 70 are not the same as at 30. They stiffen a little, like an old garden hose that's carried years of water. Slightly higher pressure can be the body's way of adapting, not failing. When his medication pushed his numbers perfectly low, his brain sometimes didn't get enough blood. That foggy feeling, that sudden wobble on the stairs, became more dangerous than the numbers the doctor was chasing so hard. One afternoon, Samuel walks into the kitchen and forgets why. His heart races. His mother had dementia. Is it starting? He begins to notice every tiny lapse. A misplaced wallet, a forgotten word, the title of a movie on the tip of his tongue. His fear grows, and with it, a new pill appears, something to help his memory. Nights become restless. His stomach turns. Yet his doctor never asked a crucial question. Does this actually stop him from living his life? Because Samuel still pays his bills, cooks his meals, tells long stories, and remembers the punchline of every joke. His brain is slower at finding names, but when someone mentions them, they snap back into place. That's not his mind disappearing. That's age, changing the speed of retrieval, not erasing the file. What his brain craves is challenge, conversation, learning, yet he was offered chemicals instead of crosswords, community, and curiosity. Months pass, and another word appears on Samuel's chart: osteopenia. His bone scan shows lower density, and the doctor talks about fragile bones and future fractures. Again, a prescription. This one promises stronger bones if he takes it for years. Nobody mentions that his bones, like his memories, are living tissue, remodeling, healing, and responding to how he moves. No one asks how many times he's fallen. No one asks if he still climbs stairs without fear. Samuel starts reading in the evenings and learns that his bones may not be as doomed as he was told. Gentle strength training, walking, sunlight on his skin, real food rich in calcium and protein. These are not dramatic miracles, just small, reliable investments. He realizes something unsettling. The system is quicker to suggest a pill than to ask how often he dances with his wife in the kitchen, or whether he still feels steady when he steps into the shower. As months turn into a year, new labels arrive. Insomnia, when he wakes at 3 in the morning and lies peacefully in the dark, listening to the quiet house. Slow digestion, when his body prefers smaller, lighter meals instead of heavy portions. Arthritis, when his knees complain a little after gardening. Each time, Samuel is offered a treatment, as if every change must be fought, not understood. Slowly, the man who once trusted his body begins to fear every whisper it makes. One evening, his granddaughter asks, "Grandpa, When did you feel the healthiest in your life? Samuel thinks quietly. It wasn't when his numbers were perfect. It was when he moved daily, slept when he was tired, ate simply, laughed often, and took just enough medicine, not more. A thought slips in, almost like a rebellion. What if aging is not his enemy? What if the real danger is believing that every normal change is a crisis that must be silenced by a pill? So Samuel does something brave. At his next appointment, he doesn't nod politely. He asks which symptoms are truly dangerous, and which are just signs that he is no longer 40. He asks about the lowest effective doses instead of the strongest. He asks what he can change in his habits before changing his prescriptions. In that small act, he takes back a piece of his life, one question at a time, choosing wisdom over automatic fear. If this story of Samuel feels a little too familiar, that's not an accident. It is the story of millions, quietly wondering if they are sick, or just getting older. On Simple Elderly Wisdom, you'll find stories that challenge fear, honor your body, and help you walk into each decade with more confidence, not more panic. If this touched you, subscribe now, like this video, and leave a comment. Which disease in your own life do you suspect might just be age trying to speak to you more gently?